ACT, or ACT, is the acronym for Assertive Community Treatment, which is a way of helping people with serious mental illness gain housing and to live regular lives in the community. And this is an approach that was developed, let's see, in the 1970s, so it's been around quite a while. At the time it was developed, it was very revolutionary because the key idea in the ACT model is that the professional staff go to where the clients are rather than the clients coming to the office. And the method ACT is very intensive. It's a team-based approach where you have a psychiatrist and nurses and social workers and psychologists working together, thinking about what it is that each individual needs and how best to help them accomplish this. So, as I say, it's been a model that's been around a long time.
You just mentioned ACT staff, but what do they do?
Whatever it takes. The ACT staff will help somebody if they need a haircut. They'll take them at the barbershop. If they need help with their housing, which is a very common problem, they will help them find appropriate housing and figure out how they're going to pay for their rent. Medications is a big issue with the folks that we're talking about that are served by ACT teams, so they help them identify what it is that's best for them and make sure that they are making informed decisions about taking their medications, which we know is a big factor in whether they are able to function normally.
But what is it intended for?
ACT programs are intended especially for people who don't benefit from office counseling. It's a more intensive approach. It's a very expensive approach compared to psychotherapy once a week. And it is aimed at people who have frequent relapses. It's aimed also at people who use alcohol and other drugs in addition to having schizophrenia and other serious mental illness. It's intended for people who may have had trouble with the law, and so they're struggling both with their mental illness as well as their legal problems. So it aims at the very most difficult people to serve.
So it's already 50 years around, but what does research say about effectiveness?
Well, the early research, starting in the 1980s, showed a series of studies that were consistent in demonstrating that the people receiving assertive community treatment stayed out of the hospital much less than control groups that were not receiving this ACT service. And so altogether there were over 20 of these studies that were completed in the 1980s. More recently, the work when ACT has been disseminated to Europe and other countries, the results have been mixed, and there have been skeptics in the UK in particular and in the Netherlands about whether this is the appropriate model for their country. Early results very strong, in large part because of the service system in the US and Canada and Australia, where these programs first got started, with lots of revolving door clients going back and forth in the hospital, and less so in some of the European countries.
Where has ACT been implemented, and has it been equally effective everywhere?
Well, it has had mixed results, as I just said, in different countries. In the U.S., even now, many of the ideas of assertive community treatment have been adopted by community mental health centers. So the differences between ACT and regular services have become smaller, and therefore ACT teams don't have their unique function as they did long ago. So it's changes in the service system as well, fewer people being in hospitals long time. It's not been equally effective everywhere, and it has a lot to do with what the country or the state or the locality is doing in terms of providing other mental health services.
Overall, what has been the impact of the ACT model on mental health services for people with serious mental illness?
ACT has changed how people think about how services should be delivered. ACT has emphasized the importance of a team approach where you have substance abuse counselors, psychiatrists, employment specialists, and nurses and social workers working together and talking on a daily basis, planning what is best for the person in a holistic fashion. So that is really a revolutionary idea compared to 50 years ago. And that idea has been adopted around the world. Another important feature is the notion of going into the home and the community and talking and helping clients where they live and function, and not requiring them only to come in to the mental health centers. So it has had a profound effect over this period of time since it was first developed.
What do you think is the future of ACT?
I think that ACT will continue to have this impact on how mental health services should be delivered in general, and I think it will continue to be a specialty program for certain groups. So I'll give you an example. In the United States, we have a lot of lawsuits, class action suits asking the courts to say that people shouldn't be required to be institutionalized in nursing homes or in hospitals long beyond the period of time that they might benefit from that. And so assertive community treatment teams have been part of these settlements, and I think appropriately so, that ACT is a good model for helping people who have been institutionalized for years and years to return to the community and become more integrated with their neighbors and fellow citizens.